I'm reaching out about the COVID vaccine in pregnancy and in breastfeeding. My name's Alyssa Titus. I'm a family doctor in Yellowknife, and I do a lot of maternity care here. I'm also the territorial clinical lead for reproductive health in the NWT. I'm also a mom of 2, and I'm currently pregnant with my 3rd. I recently helped write a public notice for the healthcare team, urging people who are pregnant, considering pregnancy, or who are breastfeeding to get both doses of the COVID vaccine as soon as possible, if you haven't already, to protect yourselves and your babies. But I know this isn't an easy decision for everyone. The majority of pregnant people in the NWT have been vaccinated against COVID. 8 out of 10 have had at least one shot, and of those, 7 out of 10 have had both shots of the COVID vaccine. We haven't seen any harms to the pregnancy or to the babies from the vaccine. For those of you who haven't been vaccinated, your concerns, your questions, your fears, these are real and these are legitimate. I can see that every pregnant person and their families want to make decisions based on what is best and safest for you and your babies. I feel like I'm in a lucky position because for me, the decision to get vaccinated felt easy. I'm comfortable with the science around the vaccine, and I'm also comfortable with the healthcare system. I'm white, I'm a settler, and I haven't had injustices and discrimination against me in the healthcare system. I haven't had medical atrocities committed against my people over the years. So I'm in a different position than many. For me, I felt very comfortable getting the vaccine early on, along with a large group of healthcare workers who all got it last winter as soon as it was available. Then I got pregnant in the summer, and I also felt extremely comfortable getting a booster dose of the vaccine as soon as it was offered to me last month when I was 13 weeks pregnant. I feel safe and protected now, but I know that this decision is not as easy for many. What I want to do today is to help everyone keep looking for the most accurate and up-to-date information, because things keep changing during this pandemic. Back in the winter, we were not strongly recommending the vaccine in pregnancy, although I personally would have felt very comfortable getting it if I had been pregnant at the time then. We didn't have safety evidence yet, although we did have theory and understanding how the vaccine worked, showing that it would likely be safe. We also didn't see that a COVID infection was much more severe in pregnancy until this summer with the Delta variant. And importantly, we didn't have much COVID in the territory last winter. We didn't have wide community spread. Since then, we now have safety data from the spring, preliminary safety data, and also information that shows that it's actually likely protective to our babies to have the vaccine while pregnant because antibodies will pass to the baby, at least to some degree. The vaccine does not cross to the baby, but the antibodies that our immune system makes do. The same happens in breastfeeding, although we're not sure if this is maybe to a lesser degree because of the type of antibodies. So both are likely protective to our babies. We also know that the Delta variant is more severe in pregnancy, and although most pregnant women who are unvaccinated, if they catch COVID, will still be okay, it is very unpredictable. And even young, healthy people in pregnancy can end up being very sick from COVID infection if they're not vaccinated. They can end up in hospital or even the ICU. From what we know from our colleague doctors down in Alberta, there are young, healthy, pregnant women who have been in the ICU, and none of them were vaccinated. We also know that the Delta variant is much more contagious and infectious, and it's no longer easy to protect ourselves from being exposed to it, as we've seen the last month or two. So that's what's changed in the pandemic, to the point where myself and my colleagues and all the expert bodies of maternity care providers and obstetricians around the world are now recommending strongly that the vaccine in pregnancy and breastfeeding is much safer and is the safest option. And the benefits outweigh any of the known small risks or any of the unknown theoretical risks. If you'd like more details or information, I'm always happy to share more in videos like this, or what's often helpful is booking a one-on-one appointment with a healthcare provider so that you can talk about specific concerns and questions individually in an open and respectful way. If you know a healthcare provider, reach out to them. If you don't have one, all of us are happy to talk about this at any point. If you have any trouble getting an appointment, let them know that this is urgent and you need to speak to someone within a few days, not wait weeks. If you've been thinking about getting the vaccine and would like to book, please reach out to your health center or public health, or if you live in Yellowknife, check online for the bookings or for the walk-in times at the vaccine clinic downtown. It can still feel unsettling to book a vaccine or to go and get your shot, but no one should ever feel coerced. I hope that everyone will feel comfortable getting their vaccine in pregnancy or breastfeeding, even to a fraction of the degree that I did. I feel very safe now. I feel so much relief being vaccinated. My kids are too young to be able to get the vaccine yet, but I know I'm protecting them. And I also know that if they caught COVID and brought it home to me, if I did catch it from them, it would be mild and I would not get very sick. I know that I'm protected from being the rare unlucky person who gets extremely sick now. And also I'm protected from all the other ways that COVID can affect our lives, such as having to isolate while we're sick, or be apart from family, or having it affect our pregnancy experience or our birthing experience potentially, and worrying about our babies. So I hope that everyone can feel even a fraction of what I feel when I got vaccinated, of that happiness and that relief and that safety. Thank you for listening to this today. Reach out with any questions. Thank you. Merci.